Good evening. Okay, we're from the AAC from Egypt. We identified the problem, which is that in Egypt, a lot of the hospitals in the intensive care units really need a new way or a new method to detect the vancomycin in real time. The need is to detect it accurately, timely, in a cost-efficient way, and our biosensor allow for all of this. And also, it comes with a mobile app on the physician mobile or on the software on the database or of the hospital to keep updated the patient profile in a smart way through the Wi-Fi. Our main target will be private hospitals because they have the higher occupation rate, and they have the higher private, have higher contribution to the health expenditure in Egypt. That's why we are targeting them. We have about 300 private hospitals in Egypt. 100 of them are centralized in the capital, Cairo. That's why we're targeting the third of the total of private hospitals. Okay, we went through the whole structure, the cost structure of the device itself. It cost per device $350, but in the mass production, that would be cut down to only 300. If we are targeting at the beginning 100 device for the first 1 or 2 years, that would be $30,000, around 1 million Egyptian pound. For getting the fund or the capital that we are going to start with, we have two channels. The first one is the AC Venture Lab. This lab is providing the AC at our university the fund that can help them start their startup. Maximum they give around 200,000 Egyptian pound, and the rest we will get it from bank loans with 20% interest, which makes it 400,000 Egyptian pound. We are targeting 100 hospitals. As I said, we set the price to be 15,000 Egyptian pound for 100 device. This is 1.5 million Egyptian pound. That should cover the cost of the manufacturing, transportation, and distribution, and primary managerial cost, leaving us with a growth rate about 40% for the first 2 years, and that's it, I guess. Thank you. Any questions?
What's your validation strategy on the product? So how we are going to get it to the market?
The validation strategy?
So you need patient studies, or what do you need? What kind of steps? What's the strategy to come to the market?
After having this prototype, we should get a governmental approval from the health authority, and then just start the mass production and start talking to the hospitals and launching the product and distribution and so on. We don't need clinical trials because in Egypt, since it's not something injected into patient, we can use it. It's not something that we inject into patient. We just draw the blood sample and use it outside, like any lab procedure.
So growing outside of Egypt will be harder, I think.
At least the first growth or the first development we think of after the first 2 years is to cover the rest of private hospital, then the public hospital, then the areas near Egypt, like the countries near in the same region. The policy there, that would be different. The policy in other countries, Definitely that would be, I guess, I mean, I don't know, but we didn't check the difference in privacy and so on. Any more questions? Okay. Thank you so much.